Are you tired all the time? Struggle with depression? Well, it could be sleep apnea. Respirologist Dr. Sachin Pendarkar is here now with how sleep apnea is often missed in women and what women can do about it. Good morning to you. Thank you so much for being here.
Thank you.
So many women are complaining of being tired all the time, but it could be something like sleep apnea. Could be. But how common is it in women?
So if you look at some of the research studies out there about how common sleep apnea is, it's probably, if you took 100 women and did a sleep test on them, maybe about 10%. So
Okay.
10 out of those 100 women would have a positive test.
Okay.
When you look at how many have symptoms of sleep apnea, and those can vary, it's probably in the order of 3 to 5%.
Okay.
So about half of the women
About
that have a positive test would have sleep apnea.
Okay, interesting. So what is sleep apnea exactly?
So sleep apnea is a chronic medical condition in which there are frequent episodes of closure of the upper airway. So partial closure or complete closure. It occurs in episodes, and that can disrupt breathing. So it interrupts sleep. It can lead to dips in oxygen level through the night, and this is a repeated cycle that occurs through the night that leads to daytime sleepiness and other consequences.
Okay. So what does it look like in women that might present a little differently than, say, men, for example?
Sure. So the first thing we know is that sleep apnea is diagnosed less commonly in women, and there might be a few reasons for that. So one would be the biology of the biological differences between men and women. So we know that there are some differences in the upper airway, that's just the structure of the upper airway between men and women.
Oh.
And then there's also the impact of hormonal differences between men and women. And so some of those hormonal differences may be protective in women, and we see that those effects are lost after menopause.
Oh, interesting. Okay. So now women often will complain of fatigue, and of course that can be many reasons for that. But if it is sleep apnea, what can women actually do about it?
So I think the first is to just think about it, and
Okay.
women may present with different symptoms, right? Tiredness, fatigue, as opposed to the typical sleepiness with snoring. So I think to be aware that, hey, there might be something wrong with my sleep,
Right.
and to maybe go and talk to their doctor about it.
Sure.
Certainly making sure that all the other things around sleep have been looked after, like getting enough sleep and not having other disruptions. But at the end of the day, if the sleep seems to be adequate in the amount of time, then thinking about other things that could be going on, like sleep apnea, for example, would be something to talk to their doctor about.
Okay. How do you test for it?
So there's a couple of different tests, and this would be a conversation with your doctor as well. So one would be a home-based test that's available sort of around the city, and that would be the most common way in Calgary anyway that people are getting diagnosed.
Okay.
But there are more advanced tests for certain patients that would be done in specialized
Like a
sleep
sleep
centers.
lab?
A sleep lab, exactly.
Okay. Interesting. So now you've got a diagnosis, let's say. What can you do to treat it?
So there's a few treatments. The most common one that people will have heard of is something called continuous positive airway pressure, or CPAP.
Right.
So this would be a machine or a box that sits on the bedside table. It's connected to a mask that blows pressurized air in to sort of hold that airway open through the night, so normalize the breathing. There's others. There's dental devices that are used commonly that sort of pull the jaw forward, so pull the airway open a little bit. Again, just worn at night.
Right.
Much less commonly, there are patients who undergo certain types of surgeries, so kind of reconstructive surgery of the jaw to open up the airway. So those are the main sort of medical treatments. And of course, there are things like weight loss. We know that sleep apnea is associated with being overweight or obese. Good sleep hygiene, watching out for excessive alcohol use, those kinds of things.
Those kinds of things. Wonderful. Fantastic information here. So just be a little bit of aware that could be what's going on.
Absolutely.
Wonderful. Thank you so much for your time and your information this morning.
You're welcome.